Thank you very much, Mukesh, and the leadership of the GGPF, together with the membership, country president of AstraZeneca, Mrs. Barbara Nell, and all esteemed panelists, colleagues, friends, ladies and gentlemen, good morning to you. And thank you for your very kind invitation. I also share the same sense of the pain we have gone through with this pandemic, particularly the second wave, where we didn't just lose a large number of people, but many of us, if not all of us, were actually now counting friends, relatives, family, colleagues that have been lost as a result of this pandemic. It's been quite tragic and quite devastating, and therefore it's important for us to always sit together and look at what solutions we can provide to help to save our nation. I want to salute the healthcare workers, especially acknowledging the critical role that general practitioners have played in the fight against COVID-19. If you recall as well, that it was a general practitioner in Pietermaritzburg who diagnosed the first case of COVID-19 in the country. Excuse me. And I had a chat with this doctor, and I was quite surprised that, in fact, it was just an index of suspicion that diagnosed a very mildly infected individual who could have passed otherwise without even going to a general practitioner. And it did indicate the extent to which even the general practitioners are themselves vulnerable, because this indicates the close proximities that the general practitioners have to their communities. A cumulative 54,685 healthcare workers have been infected with COVID-19, and 779 of them have lost their life to COVID-19. At this point, I'd like to request we have a moment of silence in remembrance of our colleagues and to honor them for their services, those who have survived to the COVID-19 virus. I think epidemiologically, we are currently going through the trough end of a second wave, which has proved to be more devastating than the first one, largely due to the fact that it was driven by a more infectious variant 501YV2, which was discovered in South Africa. And of course, we have also noticed that in the other countries, they've also identified a number of similar kind of variants. Well, probably slightly different, but similarly, there have been indications of mutation in a number of countries. 501V2 threatened to scupper all our efforts of rolling out the vaccines expeditiously, but with some quick footwork by our teams in the Department of Health and Medical Research Council, we were able to salvage the situation by rolling out the Johnson & Johnson trial under the Sisonke protocol. This is a double win as we are conducting a real-time impact study on a large cohort of recruits, whilst at the same time rolling out additional protection against COVID-19 for the front line. I am told that there's anxiety and uncertainty about the ability of GPs to access the vaccination. I will just take you through a brief slide just to show you there is a plan to deal with this matter. And maybe just before one goes very far, let me also just acknowledge the role of the AstraZeneca as a company, as well as the work that's been done on that Covishield vaccine. What we have found in South Africa is not so much for me a setback, more than it is an opportunity to learn. Science is fast evolving, and with the variants, we are going to be getting surprises. And so what this has done for us, it has offered us an opportunity to learn. And in the process of learning, we need to make sure that everyone understands that there's no issue with the AstraZeneca vaccine, but there is an issue in South Africa about the variant, therefore that we need to learn a little bit more about so as to see how to deal with our situation. And I also want to acknowledge the comments that's been made by Barbara Nell about the work that we're doing with the Department of Health in relation to the work at a community level in the early screening and diagnosis of non-communicable diseases such as diabetes, high blood pressure, and so on. For me, as Barbara has indicated, that's very, very important, because we will integrate this to the work of the general practitioners on the ground, where you can ultimately have a community health worker who will visit a church or visit a community and diagnose someone as having hypertension, refer the person up to the clinic or to the general practitioner. And by the time they get to the hospital, everything has been evaluated. That will allow the individual to get tests done in a hospital, and a health care record is already generated even before the doctor himself has seen the patients, but because of the nature of the structure of the protocol that we are setting up. So it's actually a lot of good work, and the relationship between our government, Department of Health and AstraZeneca remains very strong, and in the process we've had very constructive discussions about all the issues that have unfolded. But just back to the issue of the general practitioners, as of yesterday, private healthcare workers began vaccinating at designated sites across the country. This has been through collaboration with the various private formations. We continue to work on communication to ensure that messages filter through to all the health workers. Sisonke that's what we call this program, which is the first part, the J&J first part of the vaccination campaign, which is linked to the open label study. So Sisonke, in collaboration with GP formations, have organized a campaign to vaccinate general practitioners. Of this first batch of 80,000 vaccines, approximately 24,000 doses are reserved for the private healthcare workers. And of those, 5,000 are set aside for the general practitioners. Our target at present is to use 80,000 doses in 2 weeks. And as of 6 p.m. on 20th February, 10,414 healthcare workers had been vaccinated. And as government, we have remained steadfast in our commitment to prioritize the protection of healthcare workers. We will continue to ensure that there is adequate quality PPEs and psychological support to our professionals who have borne the brunt of the distress and the COVID-19 that the COVID-19 has brought upon us. So congratulations for hosting this timely important webinar as we cross a milestone in our COVID-19, in our fight against COVID-19. Indeed, science is rapidly evolving, and there's a need for a constant dialogue and innovation. I've seen the agenda and note that there are eminent experts who will be covering a wide number of pertinent topics. We're proud of research and academic work that has been done in this country, and we are particularly proud to play a leading role in the field of genomic surveillance. This progressive pursuit of medical precision should be celebrated as a product of excellent education in the fields of medicine and science in this country. I know there are many colleagues here who have contributed to this fortunate position we find ourselves in as a country. We thank you for the service to the people of South Africa. It is therefore important that we as government play an enabling role to ensure that all this talent is harnessed and focused on opportunities of advancement towards ideals of universal health coverage. One of the successes cited in the public health strengthening, also known as Genesis, excuse me, a report on the NHI pilot studies was the general practitioner contracting program, which was aimed to increase the number of GPs at primary healthcare level. And in those facilities, which highlighted the need to bring GPs closer to the people and to the public health service. A total of 330 GPs had been contracted by the end of 2018, and where contracting general practitioners was implemented successfully. It was evident that the doctors improved the service at a community level. Patient perception was at the quality of care improved at facilities due to the presence of the general practitioners. A key challenge identified was the need to streamline and monitor the contracts between the funds and the GPs to ensure the balance is maintained between supporting livelihoods of GPs and protecting the funds from being gouged. We look forward, therefore, to parliamentary hearings on the NHI bill, which we hope will resume very soon. The vaccine rollout is a real opportunity for us to build on the ideals of the universal health coverage. We've begun to advance this ideal by pooling resources to secure free vaccination at the point of care, and we have a digital system which we call electronic vaccination data system that guides the user from the registration through to certification. In the first phase of vaccination, we're concentrated at the secondary and tertiary facilities during this Sisonke protocol. Of course, when the wide availability of a vaccine is ensured later on towards the end of March, we will be reactivating all the sites that were planned originally for the rollout of the vaccination program. This means also that the GPs will be able to register their practices as vaccination centers as long as they are aligned to the service delivery platform arrangements and requirements. And the GPs will likely to play biggest role in phase 2 and 3. Phase 2, we're expected to net in about 16.5 million people. And of course, the other one will go beyond 20 million people. So we will be having a very busy time during on the health network. I think we need to also realize that for an NHI kind of system, the general practitioners become the main, anchors of the system, and it becomes important for us to look at how, for example, in the instance of the UK, they are the gatekeepers who will actually direct patients into which direction they need to go and what level of care they need to be able to deal with. So from that point of view, therefore, we believe it's important that we keep a very close working relationship with the general practitioners in general, and therefore make sure that on our programs, there's always a good dialogue and understanding as to what our plans are as we move forward. If the host can allow me, I can just show a few slides just to be able to indicate some of the plans we have for this vaccination rollout. So just to give you a sense here, if you look at those slides, we have towards the end of the first week, we need to have done 40,000 vaccination and 80,000 by the end of the second week. And so we're targeting 53,000 in the public healthcare sector and 24,000 in the private healthcare workers, and of course about 5,000 for the general practitioners, as I've indicated before. The current sites now are indicated here, as you will see. These sites are mainly in secondary and tertiary hospitals, and so we will need cooperation, so people will have to move into some of the areas. But later, excuse me, we will be able to open up to more sites, which will allow a bit more of flexibility and convenience. But it gives us a sense now that they've been marked to indicate how many doses are available for which site, and how many vials are there, how many vaccinators. So just to give you a sense of that. And then if you go further, you will notice that if you break them down into the various sites, it gives you the doses allocated. And you'll see there we've allocated close to 80,000. It also indicates how many goes to public, to private, and how many are targeted per day in each of the sites. So we have a target that we have to reach. And this is basically just to indicate that as we plan already, the private sector is already part of the plan. And so you'll see a certain assumption that we've had to make here, particularly as we say that we have to work for 14 days to dispose of the 80,000. But in reality, there are only about 10 days and 8 working hours. So some of the numbers that we're actually pushing should be looked at. So numbers of GPs that had to be registered for Sunday the 21st, which is now. So those are some of the numbers. We're just giving you a sense here that the general practitioners and the private healthcare workers are very much part of the entire plan. So if you look at this, it basically just gives you a flow. You need to have been self-registered, and then to continue to sign a consent form for the vaccination, and then of course they issue a voucher. This voucher only works mainly for this first part, this Sisonke part of the vaccination. It won't be used later on in the in the open vaccination program. Then, of course, when the vaccination arrives, then, of course, the vaccinator has to confirm that the details are correct, and then they look at all the details of the individual, any problems to worry about. This is the stuff you know. And, of course, vaccination is administered, and then you have to be recorded as having received the vaccination. I saw yesterday one doctor in Mangueng Hospital was the first general practitioner to receive an SMS confirming that the doctor has already been vaccinated. You should get that as well as a kind of matter of your own record that you have actually been vaccinated coming from central data system. So basically, those are some of the issues that we thought it's important just to share. All we're saying is that general practitioners are fairly much part of the entire program. So if there's any miscommunication, let's find a way of clearing that with our structures. But thank you very much, Mukesh and your team, for inviting us. And I think that if there's any challenge, let's stay in touch and let's continue to work together. Together, we'll be able to build the best health system that our country deserves. And it's important for us to understand that there are principles of equity, social solidarity, and ensuring that all our South African people get access to quality care without, being prejudiced by their inability to pay. And that's the future that a proper democratic South African dispensation should be able to offer to all South Africans as part of ensuring that the liberation of our people is complete. Thank you very much for your kind invitation and best wishes for your conference for the day. Thank you.
Thank you, Minister. And I just want to say that I really appreciate you appearing at such short notice and passing on this message to our family practitioners that there is a program in place to address their fears and concerns. I've just received some questions on our chat line, and I believe that there seems to be issues with the rollout, according to the doctor in KZN. And Minister, maybe you can reassure our doctors that all is being done to facilitate this progress and that any of these hiccups are being attended to. Thank you.
Yes, thank you very much. I did get a report that there were some hiccups in KZN in relation to the private practitioners. Let me just confirm that the arrangements we have is that the program for vaccination should be continuing in KwaZulu-Natal as in all the provinces, that everyone will be vaccinated through the sites designated by the provincial government. And this to me is to mean that when we say vaccination will take place in a public hospital or public institution, it will continue at that level. I was made to believe that the initial hitches that were experienced in KwaZulu-Natal were resolved, but if there haven't been, please let us know, because there have been a lot of teething problems that we're able to solve over the period. But once again, to just reassure you, KwaZulu-Natal is open for vaccination. If there is any hitches, we will attend to that, but we want everyone to be able to get the necessary vaccination. So the doctor in KwaZulu-Natal can give us some of the specifics if there is still a problem existing now. Thank you.
Thank you, Minister. The second question is, how do you see, what role do you see GPs playing in facilitating the vaccine rollout? And do you see some of their practices being used as vaccination sites?
Yes, in the future, we should consider that. And certainly it's something that we have said when the numbers increase, we'll obviously be looking at the extent to which we can enroll some of the general practitioners to work with us in the program. It's still a bit early because that program has been put a bit on hold for the next few weeks. So we'll be refining that, but we'll then be coming to you to indicate what proposals we have. At the moment, we've actually got quite a number of sites, so it is actually quite foreseeable that a number of general practitioners might be able to assist in the process. I think what's important as well is to understand that the structure of the vaccination program is that we have got two ways of how we deal with it. On the one side, we deal with patients who, people who will come into the public sector who will actually have nothing to pay directly. And then on the other side, we've got those who will be vaccinated with the financing of the vaccines by the medical schemes. And those will actually be able to charge the medical scheme for the vaccine and for the cost of the disposables. All of that goes to the medical scheme so that there is no direct payment by the individual patient. So that's how it's been arranged. So that is why I'm saying that at some point there's going to be a conversation to say how are we able to work through those things together, because you'll understand that most of the private healthcare will be going through private hospitals and private general practitioners.
Thank you, Minister. I have no further questions. Once again, I'd like to thank you for the time that you've taken out of your busy schedule in addressing the concerns that we have as healthcare workers. And I wish you all the best. Thank you.
Thank you very much. Thank you.